So we can begin with the first question, then asked
Yes.
by Akshay. And the question is, if a young individual wants to catch COVID-19 and recover as a way to build antibodies for immunity, is that really a bad idea?
Okay, so that's a very interesting question. And if that person who's a young person without any comorbidities, and if that young person lives alone, that young person does not come in contact with any elderly person or someone who has any comorbidities, he or she is the ideal candidate to get COVID. Now, let me tell you at the beginning of this session, because it will help clear your doubts. I got tested positive 2 weeks back. So I'm basically a COVID. I've recovered right now. I gave my repeat swab today, and that I'm still waiting for my result. But I'm a 25-year-old male, and without any comorbidities, and I would actually be an ideal candidate to get it. And when I got it, I was actually very happy because at least right now I'll get some form of immunity later in life. We don't know how long the antibodies will last because there have been no long-term studies on COVID till now, and how long the antibody will be of a sufficient titer to protect me. But it is safe to assume logically that right now it would be a very good time for me to step out. Not saying that I will put my guard down, but at least I will have some form of immunity. Now, there is no running away from the fact that the virus isn't going away anywhere. According to the WHO, almost 70% of the world's population is expected to be infected with coronavirus. So, rough mathematics, looking at 7 billion world population, 70% roughly translates into 5 billion people. Right now, figures are only in lakhs. So you can imagine that only a few lakh people actually have immunity against it, those who have actually survived the infection. So like Mr. Akshay asked, if a young person lives alone, would he or she be an ideal person? Yes, I do recommend, please don't get me wrong. I don't recommend that you please put your guard down. Keep your guard up. There's only so much that you can do to actually prevent yourself from getting the virus, but there is no running away from it. So please learn to live with it. And if you get it, it's not the end of the world. It is highly salvageable. It is curable. We don't have any direct cure for the virus per se. So we only treat the complications, or we only treat the symptoms that develop. But if caught early, if treatment is started early, if oxygen is started early, it is highly treatable. Second, just a follow up to that question is 80 to 90% of the people, when they contract the virus, they don't even realize that they have it. People are asymptomatic half the time. So you will not even realize that you are even, having the virus, and you might have even recovered. And most of the people who even contracted, regardless of their age group, they still fall under mild infection. So please don't be scared of the virus. Be scared, but don't be that scared. Let me rephrase that. Yeah.
Thanks, Dr. Agni. That was helpful. Akshay, I hope that helps. Okay, moving on to Sankalp's question. He's asked actually 5, but I'll go with the first one. What are the top 3 COVID myths you see people fall for online?
Yes. So one of the most common myths is that, it's not a myth, it's just a lack of understanding right now that once you get it, you won't get it again. No, that's not true. Once you get it, you might get it again. It's just that the next time that you get it, it will be much milder than what it was initially because you already have baseline antibodies. Now, let me give you an example. All of us, I'm assuming, are all Indians here. So we have eaten a fair share of street food. Now, every time we eat it, we don't get diarrhea, right? Only occasionally do we ever get diarrhea. But let's assume that some foreigner was to travel to India, or he or she consumes our local water, consumes our local street food, they land up in big trouble. The thing is, we have been acclimatized to the local bacteria here, the local parasites here, and we have developed good immunity against it. And one US expat, okay, from Ajero, hello, Ajero. So the thing is, please be careful when you have our local street food because I don't know how strong your immunity is. But for us Indians who have been hardy, living in these conditions, we occasionally do get diarrhea, but how long does it last? 1 day, 2 days at max? That's because we already have preformed antibodies. So the myth was you don't get COVID again. Now it's like saying that I've had COVID now, so I can roam around freely. No, it doesn't mean that. I will still keep my guard up. If I do get it, yes, I mean either I might not develop any symptoms at all, and if I do develop symptoms, then it will be milder. Second doubt that we get is, and it was similar to one more question that I suppose it is airborne. So I get it. No, just because it's airborne doesn't mean that the viral particles are just flowing around in the air, and if you just walk around and you will get them. No, it doesn't work like that. So what it means is that you can go for your morning walk, you can go for your jog or whatever, you can go for your groceries, but just make sure that you practice proper social distancing. Now, social distancing is not 2 meters, it's not 4 meters, it's actually 6 meters. Because let's assume that there is a COVID patient who's standing 100 meters away from you, he or she sneezes. There's no way you will ever get the viral particle, right? Even though it's airborne or whatever. But we can't always stand 100 meters away from the other person. That's not feasible, right? So that's why the distance of concept as I will just answer this. So the concept of social distancing came because we want to find out the minimum distance that is acceptable for the public to roam around without contracting the disease. Now let's assume that both, then this is again similar to the other question. You are not wearing a mask, the COVID patient is not wearing a mask, the COVID patient is standing 10 meters away, that COVID patient sneezes, coughs, does whatever, you will not get it. Okay. The viral particles, I mean, they usually transmit by droplet infection, and the droplets are heavy. They can't travel that far ahead. So when it's airborne, doesn't mean so it's that it's flying around in the air. It just means that it is transmissible at a community level. So it means that if you stand close enough to somebody, you will contract it. The other myth that it's not a myth, basically, it's a false sense of security that wearing your mask and wearing your gloves and going around in the public gives you protection. No, it doesn't. Even a PPE doesn't give you 100% adequate protection. There were 5 other doctors posted with me in the emergency section, and my entire team, we turned out positive. So the PPE is also not 100% effective, and also it all boils down to how you are doing proper hand hygiene and mask and glove hygiene. So few myths that I would like to dispel right now. An N95 mask is not a protective barrier. It can save you, yes, but it doesn't guarantee you 100% result. Why? Because the life of the N95 mask is only 12 hours. But what we do is all of us must have bought our N95 mask at the beginning of the lockdown, and we just must be wearing that one mask. We must be washing it. Chalo, do. And yeah, let's go for grocery. Let's go for this and that. Let's meet other people, and we're still wearing the N95 mask. No, it will not protect you. If worn properly, you will not be able to breathe in your N95 mask. It's very, very suffocating. It's not the most comfortable place to be in. So if you're very comfortable, if you're having a gala time wearing your N95 mask, please throw that away. It will not protect you. It will not offer any protection at all because air is coming inside. Secondly, any mask, now these days we have all become very eco-friendly and environmentally conscious. That's very good, but please don't compromise on your safety because of it, because the concept of reusable masks have come, these cloth cotton masks, and you wash it, right? Now the thing is, just imagine your own clothes. Every time you send them for a wash or whatever, either they become loose, either they become tight, right? Your mask is only as effective as the smallest particle, the smallest pore in its fabric. So when you have a cotton mask, right? Imagine this is the fabric of the cotton. You wash it, you expose it to detergent. The fabric may loosen, the fabric may tighten. If it may tighten some cloth, it's fabric at the end of the day, so it won't be effective. Please don't go for reusable masks. They are not a wise idea. I will highly discourage you from using them. Please go for simple disposable surgical masks. They are good enough. Surgical masks are very cheap. You get one for 20-30 rupees. Please wear that and dispose it once you worn it. The basic dictum is that you assume that it is infected once you step out of the house. For all you know, it might not have been infected, but we assume that the external surface of the mask is infected. So please don't reuse it. So that is one myth. And the second myth is again that wearing gloves will, now to nothing will ever happen. Please, I think wearing gloves makes us more daredevilish, because now we end up touching dirty things. We end up so our phones are in our pocket, our wallets are in our pocket. Now we want gloves. We've touched just about everything under the sun. We use our phone. Hello, how are you? We take out a wallet. We make payments. What are we doing? We're just spreading the viral particles everywhere. So wear gloves, but please, the most important thing that you can do is carry your sanitizer bottle with you. Small bottle carry whenever you go out, and whenever you want to adjust your reading glasses, you want to touch your phone, you want to touch your wallet, you want to touch your keys, because these are the most common things that we touch. Sterilize your hands, then you touch it. I think I've covered all the 3 doubts. If there's anything, please do let me know.
Sankalp, I hope that helps. I'll move on
Okay,
to...
one second. I wanted to answer this question. It's on
Yes,
chat.
I can answer that question along with what Sankalp has asked, which is there a way to gauge how badly the virus will affect you before you catch it? Along with that, you could cover what Ajay has asked.
As a 30-year-old type 1 diabetic with no respiratory issues, could I have complications with COVID? Have you seen any such cases? Okay, so type 1 diabetes. Now the thing is, Mr. Ajay, you would need to ensure that your sugar levels are fine. Just because you have type 1 diabetes doesn't mean that your immunity is compromised. Basically, the immune system gets compromised when your sugars are deranged. So if your HbA1c you're maintaining your HbA1c less than 5.4 ideally, but anywhere between 5.7 to 6.4 is good enough. That is considered pre-diabetic. So your sugars will still not be that deranged. Try to keep your HbA1c less than between 5.4 to 5.7. Keep your fasting sugar less than 126. Keep your postprandial sugar less than 140. Now, these are very strict conditions that I'm putting upon you, but this is what the cutoffs are. Slight relaxation is allowed, where your fasting sugar, you can go up till 120, 130, 130, 140. Try not to do that though. And your postprandial, if you're going between 140 to 199, 200, that's still okay, pardonable. Again, those are relaxations. That is not what your target should be. So if your sugars are fine, your sugars are maintaining fine, you're otherwise healthy, just having type 1 diabetes will not, impair your immune system. So it doesn't increase your comorbidity, if I were to say it like that. And what was the other question, Samira?
It was if there was a
Can
way
you predict? Is there any way to predict? No, there is no way to predict. You can just assume that someone who is old, someone who has hypertension, someone who has diabetes, someone who has cancer, someone who has asthma, someone who has any comorbid condition, their chances of being affected by coronavirus will be higher than what someone without those complications, without those comorbidities will have. But that doesn't mean that that person will not make it through. We've seen cases, 70-year-old slum dwellers, okay? So they're all emaciated, don't have any, calorie reservoir, and they are hypertensive, they're diabetic, and they have survived. And this is in a government hospital like KEM, where we have patients all over the place, and they have still survived. So it's not that just because somebody is old, somebody has some other comorbidities, they will succumb. No, it's not 100% fatal virus. Had there been an epidemic of Ebola or Zika going around, yes, we should have been very, very scared. I would have been very, very scared. All of us should have been scared. It's a flu virus. We can take our chances. So yes, at present, there is no quantitative method to predict how badly someone will react to the virus or how bad the disease will be, because even 60-year-olds have been completely asymptomatic and have not even realized when they got the virus and when they recovered. But we can just qualitatively predict that yes, someone who is old, someone who has other comorbidities, they might have it bad.
Okay, and a follow-up question there.
Yes, please.
Are people who smoke cigarettes every day, yes, Bharti, are they prone to catching the virus, or can it get worse for them?
I would not passing any judgment here, but it's not good for your body. I would recommend that you don't smoke. If you're having difficulty in leaving, please try Nicotex patches or chewing gums. They are very nice. Otherwise, we can even put you on to methadone replacement for chronic smoke. I mean, for chain smokers who are having difficulty in letting it go. The problem with smoking is that it's basically you're lighting a fire in your entire respiratory tree. It will impair your local immunity. It will it will also damage your respiratory cilia, those hair-like micro hair that we have on us or on all our cells. And their main function is like that of an escalator, like a conveyor belt in the airport. So they carry all the viral particles, dust particles, whatever, and they bring it from down, bring it to my throat, and they help me cough it out. So smokers, their respiratory cilia is highly damaged. That's why they can't. So normally when we speak or when we talk, we don't cough every day, right? But our sputum and our phlegm just comes out. But any chronic smoker, every morning they have to manually cough or pump their chest or whatever to help clear their entire throat. They will not be able to remove all the debris. So smoking will damage your local immunity of your respiratory tract. It does not reduce your overall immunity. Okay, so don't get me wrong. It will damage the local immunity. So your local immune system of your respiratory tract will be damaged, and you will, you do land the risk of contracting more upper respiratory tract infection. And if you've been a chronic smoker for long enough, and these days we are seeing COPD like changes, emphysema like changes even in younger age groups because of chronic smoking. So if you're unlucky and if your lungs have progressed to that stage, then it also increases your chances of contracting pneumonia. And coronavirus being a respiratory virus and it just damages the respiratory epithelium and the respiratory tract, basically quit smoking. Yes, Shushruth. Because it damages the respiratory tract, not the wisest thing to do when there's a pandemic going on. Please quit smoking. Nicotex tablet will work very well. Chewing gum.
Please quit smoking. I like to stress on that more and every day from now on. Moving on to Sankalp's third question. How exactly is the infection spread? Is it slightly airborne or does it require close personal contact only?
So like I spoke about this earlier, when you said slightly airborne doesn't mean it's flying around in the air. So you can please, safe to say that you can go for your groceries, you can go for your morning walk or whatever. Please maintain adequate distance from other people because you don't know their status. They may be absolutely healthy, they may appear absolutely healthy, but they might just be carrying the virus. Like classic example will be Typhoid Mary. I'm sure all of us must have studied this in school. She was a cook. She was a carrier of Salmonella, typhoid, and she ended up creating a mini epidemic in UK, and around 1,000, 2,000 people, wherever they contracted Salmonella, typhoid disease, because her hands were dirty. She never contracted it. She had no symptoms at all. She would just give it. So just because somebody looks healthy, somebody does not have fever, you cannot rule out COVID, that person is very lucky that without developing symptoms, they will eventually clear the virus and get immunity. But please assume everyone to have COVID when stepping out. So just maintain adequate distance, maintain proper social distancing, maintain proper hand hygiene, maintain proper mask and glove hygiene, and you're good enough. What was the first part? Wait, it's on my phone. And about close contact. No, you need, please define close contact. If close contact means living in the same household, then again, it's not a necessity that all of you will contract it, because I'm sure, I'm sure all of you must have someone in your family or extended family or in your neighborhood where only one or two people in the house are positive, but everyone is not positive. That means they've been eating from the same plates, they've been using the same washroom, they've been living together, cohabiting the same. So close contact does not guarantee you infection, but yes, it highly, highly, highly increases your chances of getting it. So that is the reason why we all advocate quarantine, so that we don't end up giving it. Now, close contact doesn't only mean, living in the same household or sleeping on the same bed. No, it also means that if I'm talking to you, I need not sneeze at you, I need not cough at you. Even if I'm just talking to you, normally my mask is down, your mask is down, or my mask has a leak, your mask has a leak. and we are talking, droplets keep on getting transmitted. You might have noticed that, suppose you're studying and you yawn, your book becomes wet, because it's not like you've coughed it out, but droplets keep on falling. So droplets will be formed. So just when you're talking to somebody, also talking, not doing anything more, please maintain distance. Now that is not feasible now for the rest of your life. You can't be living like this, so you will put your guard down eventually. But be aware that, so example, my screen is less than a meter in front of me. If you were sitting right here, we were having a normal conversation, I might get it, you might get it. So that's what it means. Once again, now let me just answer the questions. Raw haldi. Basically, can intake of multivitamins help to build my immunity? Yes, there's no harm in taking it, but it's not a foolproof method. So vitamin C, D, B12, please take it. Also, my mom asked me to take tulsi drops up to her. Okay, raw haldi, raw tulsi, all these gharelu nuske, please azmao very well. They have been working since time immemorial. That does not mean it's a cure. That doesn't mean just because I'm overdosing on haldi and tulsi and chawanprash and limsi that I will not get it. No. If that was the thing, then we would not have spent money on vaccines. We would have just maskly given everybody, please take haldi and all. There is absolutely no harm in taking it. Please, I'm not making fun of your mother or anyone. I myself have been taking haldi doodh. I myself have been having chawanprash. I myself have been having limsi. But it is not foolproof. It is just there to boost your immunity, but it doesn't prevent you from getting it. It's a good thing to take. It will improve your skin. It will improve your internal organs. Please take it. It will detoxify your body till an extent, and it's good for you. It's anti-inflammatory. Please take it. But I will no doctor will ever give it to you in writing on a legal pad that once you take it you will not get it. So, but do take it.
The question then would be: are all of these remedies placebo? Like,
No, then can't call them placebo because see, it is increasing your immunity, right? It's making you fighting fit. Like, if why I gave you an example of a slum dweller in my previous examples was because that person doesn't have a good diet. That person doesn't have good calorie reserve, and yet that person recovered. Now, when I got COVID, I lost a lot of weight. Basically, your body needs all those calories to fight off the infection. Now, the reason why I gave you that example of that slum dweller was because that lady was very thin, that lady was old, that lady had micronutrient deficiency, that lady had macronutrient deficiency, and yet she recovered. I'm not saying that do you please compromise on your nutrition. No, I'm just saying that people are recovering. It is not a death sentence. So please don't be that scared of it. But having said that, it is not a placebo. It's just that we don't have adequate studies to prove. See, when you report something as placebo, then we have to do a proper statistical analysis. You have to find a p-value less than 0.05, chi-square. All those tests have to be incorporated. It's not a placebo. Please do take it. Include it in your routine. Limsi or vitamin C, whatever brand is available. Chawanprash, haldi. Please take it. It'll just, you have some chance it'll do something maybe.
Okay, awesome. Thanks, Dr. Agni. We have 5 minutes left, so I'll go ahead with the last two questions.
These prevent cytokine storm. Yes. Okay. Were you talking about these two questions?
No, Sankalp has other two questions. You can take these. We can move on to Sankalp, and then I'll hand it over to Tanmay.
Okay. These prevent cytokine storm, doctor. Okay. Yeah, like I said, they're anti-inflammatory. So the main pathology or the main pathogenesis of COVID is because of the cytokine storm. Your interleukins are all over the place. Your chemokines, cytokines are all over the place, and that is why we land up with mass inflammation. Smoking causes local inflammation in the respiratory tract. It causes local inflammation in the heart. That's why you also it gives rise to atherosclerosis, coronary artery disease, because it impairs your it moves you to a pro-inflammatory and a pro-cytokine state, right? Smoking does that. So anything which will impair your cytokines, anything which will put your body in a pro-inflammatory state, such as stress will alter your cytokines. It will again make the body's condition perfect for any cytokine storm or any inflammatory condition. SLE, all these conditions which are pro-inflammatory will alter that. So like, it's a very good thing, like you said, haldi and all, they alter the cytokine system. They make, they shift our balance towards an anti-inflammatory system. And like I mentioned that earlier, it's anti-inflammatory. But just because something is anti-inflammatory, it doesn't mean that you will not get it. Psoriasis, a very common skin condition, is because there is local inflammation in the skin. That doesn't mean that if I have haldi doodh, then if I have chawanprash, or if I take an NSAID, an anti-inflammatory drug, my psoriasis will go away. No, it doesn't work like that. So yes, it will. It works at a very micro level, where your body, where we, just because, like I said, just because someone is taking stress doesn't mean they will have a shorter lifespan. And just because, it's just that it will show in their lifestyle. Like the hair will become white earlier, the skin will become wrinkled earlier. High stress. Look at any professional with a very high stress job. They look 10 years older than what they are. That is what stress does to you. That is what smoking does to you. That is what the power of cytokines is. So when you take all these doodh haldi and all these things, I'm not saying it will reverse aging and you will, once you start taking doodh haldi at the age of 18, forever, for the rest of your life, you will be 18 only. No, it doesn't work like that. It's just that it will halt or slow the process of aging. So I hope that answers your question. I mean, I don't know if I'm being able to come across, but I hope it answers your question. Chat. Instead of surgical mask, is it safe to use the no cotton fiber? No, that's what I spoke about earlier. Please don't use these reusable masks. Yeah, I know we should always be concerned about the environment and we should do our level best. But as of now, with the technology that we have, cotton is not a good material to be rewashed again and again. Because if your pore size increases because of the detergent, because of the fabric or whatever, you're in for trouble. So till the time we come out with good, sustainable, washable masks, which will provide you the same efficacy after repeatedly washing and wearing, only then please use it. Till that time, you will have to increase your plastic output and wear surgical masks. I'm sorry, there's no option.
Awesome. Finally, before I move it on to you, Tanmay, you suggested a really cool idea that we probably hadn't thought of. That if you have a clubhouse, convert that into a mini hospital, get beds. Are there any other tips you can share that can prepare us more as a community that we can easily probably implement?
See, again, someone asked about domestic help, right? And because then that comes into community guidelines. There is no problem if your domestic help is coming, as long as your domestic help is not infected. It's as simple as that. Now, it would be insulting to someone if you constantly hover on them around over the head and say, now wash your hands, wash your hands, wash your hands, wash your hands. It would be insulting for your domestic help if you do that. And then either they will not wash their hands properly, or it'll just be a placebo, just put some sanitizer. Like all the buildings right now near the watchman have a sanitizer, and you have to use that before you touch the lift buttons, right? Who is actually monitoring how you are washing your hands? Whether you did a proper surgical hand wash, or you just took a one drop here. Yeah, that's not hands. No, hands are very dirty. Please, it's just just for your own satisfaction you're doing that hand wash. So now, if you constantly tell your domestic help, abhi haath do, abhi haath do, abhi haath do, abhi sabji kaatne se pehle haath do, abhi bartan do, they will not do it. It will be insulting. So if you can train them without coming across as mean or insensitive, that would be amazing. Now, if you're living in a building and all your domestic helps are coming, I'm sure your building should form hand hygiene protocols, some protocols. Teach all the domestic help that will come to that building. Take a class for them. See, you teach a person, you give it's an old Chinese proverb, I'm sure all of you have heard it. You give a man a fish, you feed him for a day. You teach a man how to fish, you feed him for a lifetime. So you please take classes for your domestic help that are coming to your buildings, wherever you live. Teach all of them so that they can also, disseminate the knowledge further into the community. And now that they've already been taught, now when they enter your houses, it will not come across as mean or rude or insensitive, right? And you do not look at them as dirty or something. That's very inhuman. So teach them, train them, form your society protocols, and then let them in. What's the harm?
Awesome. Thank you so much, Dr. Agni, Sankalp,
Yes.
and everyone else who asked the questions. I hope that helped. Over to you, Tanmay.
Hey guys, I thought I'll give you context. I'm seeing Agni after 8 years.
Yeah.
So we went to school together, and I just really want to thank you, Agni, for coming in less than 24 hours of notice.
Thank you for having me. Yeah.
And I think something I realized over the weekend is, every problem seems distant, macro, worldly until your first degree gets hit, right? So on Saturday, one of my uncles, his daughter got diagnosed with COVID. And just as recent as yesterday, as everyone in the team knows, Ishan, who's our team member, also got diagnosed, right? So of course, like we're very pro mental health and everything. So Agni, the question for you I had was, what can we as a team do for our team member? What can we as a family do for our family member, just to sort of support them and empathize with them? And how do you empathize? Because I don't know what they're going through. So
Okay. So when I was diagnosed, and I'm going to share this with everybody because it makes a huge difference. I'm guessing that your friend is home quarantined, right? Or is he admitted in a hospital?
So our team member Ishan is home quarantined as far as I know, but my relative is
Okay.
admitted in Medanta in Gurgaon.
Okay. So now the person who has been diagnosed is very scared. Okay, because of the entire hype around the pandemic. We don't have sufficient studies, so we don't know. So the person is very, very, very scared, and they're bound to be scared. So any symptom that they will have, they will perceive it to be something which is more sinister, and they're going to be under a lot of stress. So one thing that all of you can do and this is one thing that all my relatives and all my friends did, just keep on calling them, but not so much that they don't sleep. Okay. Ask them how they are. Send food. Okay. Because of the lockdown, no lockdown. I don't know what the situation is in Gurgaon, but provide them with groceries, provide them with the essentials that they might need, because they cannot leave their house because they will essentially be under lockdown. Their house will be sealed, right? So provide them with food, medicines if they don't have access to medicines, or if them supplies are running out, and just help them rest, keep them motivated, keep them happy. Because once and if you can, and if you know someone who's already recovered, make them speak to a person who has already recovered. See, when you know someone who has already crossed the bridge, you get a lot more confidence, and you feel, okay, if he or she has done it, and if he or she has made it through, I will also make it through. And just provide support. That's all. Food, water, there's very little that humans actually need. So you give them that. And don't call them constantly. They will get irritated because their relatives will also be calling them the entire time. Let them sleep. When I was in my initial few days, I was sleeping 20 hours in a day. Your body needs that much rest. If you're lucky, you will have it milder, but you need to sleep, you need to rest. So if you can just send pre-cooked food or whatever so that they don't have to cook it, that'll be amazing. They just have to heat it, have it, let them rest, send them your messages, keep their morale high. And for your uncle who's in Medanta, so I'm sure he must be getting very bored. So send them some entertaining movies to watch. Let him rest. Hospital food is terrible. It's very bland, very boring. And send them home cooked food, because to fight the infection, you need a lot of calories. You need some good food. And food is something which really boosts your morale. Okay. And you must have all noticed in the times of lockdown, when you wanted to order something and that Zomato guy came, oh wow, what an amazing feeling. Aaj to kuch khaya mast. So food is an amazing mood enhancer. Please send them that. It also will make that personal angle will come. That, oh, someone has sent me food, and you just feel nice about it. So that's it. I mean, it's just a flu at the end of the day. So there's only so much that you can do. And at the same time, that so little actually means a lot to the patient. So yeah, that's about it.
Thanks, Agni. And although I've told this to you on Instagram, I'll share this in front of everyone. I have a lot of respect for Agni because I was reading something first post where he starts his day at 5:30 a.m., right? And he has one meal a day, and then doesn't have water because he can't use the washroom during the day for 8 hours. There's no other meal. And that's how his life is right now. And I think it's just incredible how, like, he's there. So it's a good stuff.
Thank you.
And all the best. Thank you for coming.
Thank you so much. Thank you.
Thank you so much, Dr. Agni.
Thank you, Dr. Agni. This is super.
Thank you. Thank you, uncle. Thank you so much.
Take care. Bye-bye.
Thank you. Bye-bye.
Bye, everybody.
How do I?